So first, we will have to take up the calcium, because parathyroid plays a lot of role in calcium balance. It is a hypercalcemia, hypercalcemic, okay, hormone. You know, the parathyroid is found right behind the thyroid gland, okay? It's four, very small, sort of a pea size behind the thyroid. That's why if you do thyroidectomy, be sure that you recognize the parathyroid gland beforehand so that you won't be able to cut it, okay, or destroy it, because the patient can undergo a crisis. Okay, remember, this parathyroid hormone is for calcium balance, and it is 4 in number. So if you take out one, the patient might undergo severe hypocalcemia, okay? So what will happen? The patient can undergo tetany, okay? So we'll take up first the physiologic role of calcium. Calcium is a very important element of the body. One role of calcium is for hemostasis, so activation of the clotting enzymes. You already took this up. It controls the membrane excitation. So just like in your, what do you call this, muscle contraction. This is very important. And it is bound to cell surfaces and stabilize membrane and intracellular adhesions. Calcium is important in cell-to-cell adhesion. It is bound to cell surfaces. So it stabilizes membrane adhesion. For muscle contraction, you remember during the first part, muscle contraction of skeletal muscles, the calcium from the sarcoplasmic reticulum, it goes out of the calcium depot and then binds to the troponin myosin complex. Okay, so it takes out the what do you call this, the troponin myosin complex to make it active. Okay, tanggalin yung takip. That is the role of the calcium there, so that actin can bind to myosin. All excitation secretion processes, for example, the release of hormone from endocrine cell and the release of other products of exocrine cells, are essential. They need calcium. Also, for neurotransmitter release, you need calcium. Just like in your acetylcholine, release of acetylcholine in the neuromuscular junction, the calcium has to get inside the membrane. Then the vesicles will attach and to the membrane, and then cellular membrane, and acetylcholine is released. Without calcium, vesicles cannot attach to the cellular membrane. So that is one importance. And also for the production of milk and in the formation of the bone and teeth. Calcium is just a small element, but it has lots of function. And so you cannot really disregard calcium. Calcium distribution. More than 99% of the total calcium is stored in the skeleton, in the bones. A skeleton of a 70-kilogram man has 1,000 grams of calcium. In the extracellular fluid compartment, only 1 gram of calcium is found. That is only 0.1%. And 1% in the cells and organelles of the cells. Okay, the rest is in the bones. The skeleton serves as the storage depot also for phosphorus, aside from calcium. Has 85% of total body phosphorus, the bone. This is 14 to 15% in the cells and more than 1% only in the extracellular fluid. The intracellular fluid has more phosphorus. The bone serves a third line of defense in the acid-base regulation. Remember, you had this lecture already. By virtue of its carbonates, bicarbonates, and phosphate content. In the plasma concentration of total ionized and non-ionized calcium is about 9.4 milligrams per deciliter, or 5 equivalents per liter, or 2.4 millimoles per liter. The calcium is present as ionized or free, 50% of it. So 1.2 millimole per liter. It is complexed with biphosphate, bicarbonate, or citrate ion, 9% of this calcium, 0.2 millimoles per liter. It is bound to protein, primarily to albumin. 41% of calcium is bound to albumin. So 50% is free. Okay. The sum of ionized plus complex calcium is the diffusible fraction of calcium. It is 55% of calcium in the body. The protein-bound form is the non-diffusible fraction, 41%. The parathyroid hormone, calcitonin, and vitamin D regulate the serum ionized calcium concentration. There are two major pools of calcium in the body. Consider two major pools. The larger pool is over 99% of total, consists of the stable, mature bone. This is not readily exchangeable. This is not available for rapid mobilization if there is an emergency. The smaller calcium pool is less than 1% of total. This consists of the labile young bone, readily exchangeable because it is in a physicochemical equilibrium with the extracellular fluid, and consists of calcium phosphate salts. Thus provides an immediate reserve for sudden decreases in blood calcium. So when calcium iron falls below normal, there is hypocalcemia, right? When there is hypocalcemia, the nervous system becomes more excitable because of increased neuronal membrane permeability to sodium. So allowing easy initiation of action potentials. So tetany occurs when blood calcium concentration falls from a normal of 9.4 milligrams per deciliter to around 6 milligrams per deciliter, or 35% below normal. Much more lethal at 4 milligrams per deciliter. When there is hypercalcemia, it depresses the nervous system and its muscle activities. So there will be a decrease in the QT interval of the heart, and the patient doesn't have appetite. There is constipation, probably due to lack of contractility of the muscle walls of the GIT. This usually appears, the constipation appears when calcium levels rises above 12 milligrams per deciliter. More so if the calcium level goes higher to 15 milligrams per deciliter. When calcium rises more than 17 milligrams per deciliter, calcium phosphate crystals now will precipitate inside the body. Okay. Now, bone calcium is found in the form of your hydroxyapatite crystals. The calcium phosphorus ratio in bone is about 1.7 to 1. A dry fat-free bone consists of 2/3 mineral, inorganic, and 1/3 organic matrix. What is your organic matrix? 1/3, 90% of the organic matrix is your collagen fibers. The remainder is ground substance. What is responsible for the synthesis of your collagen fibers? The vitamin C, right? So you have to take in vitamin C from the outside because man doesn't have the enzyme oxidase. So man cannot manufacture collagen fibers. You will just say, I will just take plenty of orange juice, calamansi juice, fruits, lots of vitamin C. That is true before, during the 1930s, 1940s, 1950s, when there was not much pollution on Earth. So there were lots of vitamin C inside. What happened? When there are lots of vitamin C in the soil. So our citrus fruits has plenty of vitamin C. So no need to take in vitamin C pills, okay, vitamin C tablets. But nowadays, with the pollution of our environment, we need to take in vitamin C, minimum of 1,000 milligrams a day. But you can go as high as 6 grams, especially if you are about to undergo surgery. When I had my surgery before, 1 week before surgery, I took in 6 grams of vitamin C a day, 2 grams in the morning, 2 grams at noon, 2 grams in the evening after every meal, because you are supposed to take this in with a full stomach. And the surgeon was very glad. He said that if only, my surgeon was Dr. Ike Marin. He said that if only all patients have the same tissues that I have, then it would be very easy to do surgery because they are very well defined, you see? So that means it's really good to be taking in vitamin C because kaya nga, collagen synthesis, this is very much needed in the bone formation. Now, over 90% of the organic matrix is collagen fibers. The remainder is ground substance. Inorganic crystalline structure imparts an elastic modulus similar to that of concrete. This is composed of calcium and phosphate. So your hydroxyapatite is equivalent to 10 calcium plus 6 phosphates and 2 hydroxyl group. That is the composition of your hydroxyapatite crystals. Calcium regulation involves 3 tissues: bone, intestine, and kidney. Three hormones: parathyroid hormone, calcitonin, and activated vitamin D3. And 3 cell types: osteoblasts, osteocytes, and osteoclasts. Okay? 3 tissues: bone, intestine, and kidney. Sorry. In bone, calcium is found in the form of hydroxyapatite crystals. The calcium phosphorus ratio in bone is about 1.7 calcium to 1 phosphorus. So in bone, the collagen forms the foundation of the bone. And here comes calcium. It lays over the collagen in the form of your hydroxyapatite crystals. So your bone now is pliant but hard. Ordinary fall cannot break the bone unless there is really a very serious accident. Okay? When you can develop bone fractures. But ordinary fall cannot break a bone because of the tensile strength of the collagen fibers. That's why if your collagen fibers are strong, your bone is pliant. And here comes calcium, then it will become hard but pliant. Let us go back to the calcium and phosphate. The usual intake is 1,000 milligrams per day, okay? And 35% of that calcium is absorbed. So around 350 milligrams per day. And the rest is already excreted in the feces. Now, 90%, 250 milligrams of the calcium will enter the GIT, also from the GIT juices and sloughed off mucosal cells. And more than 10% is excreted daily in urine, 100 milligrams per day. The factors that regulate, you already took this up when you had your lecture on genitourinary tract, okay, your kidneys. So this is just sort of a review. The factors that regulate your tubular calcium reabsorption in the kidneys. One is your parathyroid hormone. PTH increases calcium reabsorption in the loop of Henle and the distal tubules, not in the proximal tubules, okay? This is independent from the action of your parathyroid hormone, your proximal. Another factor is the plasma concentration of phosphate. Increased phosphates stimulates parathyroid hormones, so increased calcium reabsorption, thus reduce calcium excretion. Your metabolic alkalosis can increase calcium reabsorption, so decrease calcium excretion. And your metabolic acidosis can decrease calcium reabsorption and increase calcium excretion. So you have decreased calcium excretion in the kidneys if you have increased parathyroid hormone, decrease extracellular fluid volume, decrease blood pressure, and increase plasma phosphate. And if you have metabolic alkalosis and decrease vitamin D3. Increase calcium excretion when you have decreased parathyroid hormone. Increase extracellular fluid volume, increase blood pressure, and decrease plasma phosphate. And if you have metabolic acidosis. The phosphates, on the other hand, all phosphates is absorbed in the blood from the gut, from the intestines, and they are all excreted in the urine. Remember, calcium is only secreted in the kidneys, only filtered and reabsorbed. Okay? Calcium is not secreted. It is only filtered and reabsorbed. I would like to correct that. Not secreted. It is only filtered and reabsorbed. 65% is reabsorbed in the proximal tubules, 25 to 30% in the loop of Henle, and 4 to 9% in the distal and collecting tubules. Bone calcium is found in the form of your hydroxyapatite crystals. So calcium regulation is regulated by 3 tissues: bone, intestine, and kidney. In the intestine, yes, you have a problem.
Be confident down there. Use Lactimea naturally for your everyday feminine wash. 99%
Are you done? You're done? Okay, let us continue. Calcium is regulated in the kidneys, okay? You had this lecture in when you took up your kidneys in your urinary genital urinary tract, okay? So this is absorbed in your proximal and your loop of Henle and in your distal tubules. Most of the calcium is reabsorbed in the proximal and in the loop of Henle, and what remains is reabsorbed in the distal tubules according to need, okay? So if you have increase in the extracellular fluid, increase calcium excretion if you have plenty of calcium in the extracellular fluid like that. And in the bone, 90 to 95% is collagen, which gives the pliability, tensile strength of the bone. And the remainder is ground substance. This is composed of extracellular fluid plus your proteoglycans, your chondroitin sulfate, and your hyaluronic acid. Your proteoglycans in the ground substance help control the deposition of calcium salts and helps in bone repair after an injury. So your bone salts are calcium and phosphate. This forms your hydroxyapatite crystals and is responsible for the hardening of the bone. When there are heavy metals that are deposited in your bone and some radioactive materials like your uranium, your plutonium, strontium, these are radioactive substances, your lead and other heavy metals, if they are deposited in the bones, for example, because the patient has been exposed, has a history of exposure to these materials, then the patient can develop later on a form of cancer in the bone because these substances can cause prolonged irradiation of the bones. So this can form an osteogenic sarcoma, cancer of the bone. And usually This is due to this. Heavy metals, sometimes mercury, like that. Now, 3 hormones, PTH, calcitonin, and vitamin D3. We'll take that up later. Now, how does bone calcification take place? Calcification. For example, there is secretion of collagen molecules, okay? And then the ground substance by your osteoblasts. The osteoblasts, osteocytes, and osteoclasts play a role in the bone calcification. These collagen molecules are called your monomers. And so these collagen monomers, they polymerize rapidly to form your collagen fibers. And so now these are called your osteoid. They are cartilage-like materials, your osteoid. But the difference is in the cartilage, calcium salts doesn't precipitate in it. In the cartilage, in the osteoid, the cartilage and the calcium salts readily precipitate in it, unlike the cartilage. Some of the osteoblasts will be trapped in the process of formation of collagen fibers. So this will be trapped in the osteoid and become quiescent. So now this will become osteocytes, from osteoblasts to osteocytes. After osteoids are formed, calcium salts begin to precipitate on the surface of the collagen fibers. Now, the precipitates first appear at intervals along each collagen fiber, so forming a nidus that this will grow rapidly and multiply over a period of days. So that will form your hydroxyapatite crystals. A few percent remain in the amorphous state, not crystals. This amorphous state is an advantage. See, nature preserves. This amorphous state can easily be absorbed in case there is a need for extra calcium in the extracellular fluid. Now, in the process of formation of your hydroxyapatite crystals, it is being controlled by your pyrophosphate. This inhibits hydroxyapatite crystallization and calcification of bone. So that if you have plenty of pyrophosphate in your body, your bones are soft. Okay? So you need this, but nature also regulates. So you have to regulate the amount of your pyrophosphate in your body. These are regulated by your tissue non-specific alkaline phosphatase and your nucleotide phosphatase and your ankylosing protein. You read about this in your book. Hormonal control of your calcium metabolism. Parathyroid hormone. This is a polypeptide secreted by the chief cells of the parathyroid glands. This is hypercalcemic. Exerts effects on the bone, the intestine, and the kidney. And regulates only plasma calcium. Inverse relationship exists between plasma calcium and parathyroid secretion. So when the amount of calcium will decrease, parathyroid hormone secretion increases. As plasma calcium increases, parathyroid hormone secretion decreases. Calcitonin is a polypeptide secreted by your parafollicular C cells of the thyroid. That's why they are very near each other, the parathyroid and the thyroid gland, because the calcitonin comes from the thyroid, but its action is on calcium. It is a hypocalcemic hormone. It exerts a biologic effect on the bone, the intestine, and the kidney. There is a positive linear relationship that exists between plasma calcium and calcitonin secretion. As plasma calcium increases, calcitonin also increases. When plasma calcium decreases, calcitonin decreases. Calcitonin release is stimulated by pentagastrin. Your vitamin D3, cholecalciferol, is a corticosteroid. This is the largest steroid hormone. Sorry, that comes from the neighbor. We are across LBC. So the term vitamin D denotes both vitamin D2 and D3. In humans, the storage, transport, metabolism, and potency of vitamin D2 and D3 are identical. Only the active metabolites of vitamin D exert biologic activity. Your calcidiol, 25-hydroxy-vitamin D3, or 25-hydroxycholecalciferol, is the major form of vitamin D. This is 2 to 5 times more effective than vitamin D3 in preventing rickets. But your calcitriol, or your 125 dihydroxy vitamin D3 or 125 dihydroxy cholecalciferol is another active metabolite of vitamin D. On a molar basis, it is 100 times more potent than calcidiol. What are its physiologic actions of your parathyroid hormone? This increases mobilization of calcium and phosphate from non-readily exchangeable calcium pool, so responsible for bone dissolution. Stimulates the activity of your osteoclasts and osteocytes. Inhibits osteoblastic activity because of bone dissolution, okay? Promotes active reabsorption of calcium in the distal tubule. The proximal tubule is independent of your parathyroid hormone. This inhibits phosphate reabsorption in the proximal tubule and promotes calcium and phosphate reabsorption in the intestine by activating vitamin D. The unopposed effects of parathyroid hormone is hypercalcemia, hypophosphatemia, initial hypocalciuria, followed later by hypercalciuria in the urine, then hyperphosphaturia. Your calcitonin inhibits osteoclastic activity. Inhibits osteolytic action of your osteocytes. Increases alkaline phosphatase synthesis of osteoblasts. Inhibits jejunal absorption of calcium and phosphate. Promotes urinary excretion of calcium and phosphate. And sodium chloride. Your calcitriol acts synergistically with your parathyroid hormone to cause bone dissolution. This is your vitamin D3, promotes intestinal absorption of calcium and phosphate. How does it promote? Promotes distal tubular reabsorption of calcium. Promotes distal tubular reabsorption of phosphate. How is your vitamin D formed? 7-dehydrocholesterol from cholesterol in the skin. Once exposed to sunlight is converted to your prey vitamin D3. Then it is brought to the liver. Your vitamin D3 cholecalciferol is being acted upon by your 25-hydroxylase and converted to 25-hydroxycholecalciferol. When it is acted upon by 24-hydroxylase, it is converted to 25-dihydroxycholecalciferol. This is inactive. But when 25-hydroxycholecalciferol is being acted upon by 1-alpha-hydroxylase, this is being converted to 1,25-dihydroxycholecalciferol and to 1,24,25-trihydroxycholecalciferol in the kidney. That is your D3. No, D3, 125. Dihydroxycholecalciferol functions as a type of hormone to promote intestinal absorption of calcium. How does it do it? It forms calbindin, a calcium binding protein in the intestinal epithelial cells. This transports the calcium into the cell cytoplasm towards the basolateral membrane by facilitated diffusion. The rate of absorption is directly proportional to the quantity of this calcium binding protein. So the effect of vitamin D is actually indirect in the absorption of calcium in the intestines. It is not a direct action. It will form first calbindin in the intestinal epithelial cells. And this calbindin transports calcium into the cell cytoplasm towards the basolateral membrane, then towards the capillaries. Calbindin remains in the cells for several weeks, thus prolonged effect on calcium absorption. Causes of vitamin D deficiency in children. Rickets in children and osteomalacia in adults. Lack of vitamin D in the diet. Inadequate sunlight exposure. We don't have inadequate sunlight in the Philippines because we are in the tropics. fat malabsorption. If fat cannot be absorbed, when there is vitamin D deficiency, what happens? Decreased calcium and phosphate absorption, decreased serum calcium and phosphate, increased parathyroid hormone secretion, increased bone resorption. Because what happens if you have vitamin D deficiency? Lack of calcium, hypocalcemia, inadequate bone calcification in the adults. That's why fracture is easily developed in the adults. The adults can easily fracture. Is a slight fall can already fracture the bones, especially the bones of the extremities. For example, a fall. The tendency is for you to use your arm to brace yourselves. And so the bones in the hands and arm, in the forearm, can fracture easily. Okay? Because of lack of vitamin D. So poor bone mineralization develops, non-fusion of epiphyseal plates, and bone softening in children. That's your rachitic rosary. Okay, in the ribs of the children. That's it.